to talk through two major public health problems in 10 minutes. We've got to be fast. Let me first get my slides in. I just shrunk it. Yes. Those are not my slides, though.
All right, we're getting somewhere.
All right, great. So these are two major current public health problems, less from a historical perspective. If I were to come up with a list of leading causes of death in Philadelphia today, this is the ranking I get. It may seem sort of normal to you, but if I were to go back, say, 150 years ago, during Philadelphia's real prominence, this list would have been totally different. It would have been dominated by infectious diseases like cholera, yellow fever, dysentery, pneumonia. Today, infectious diseases are not a major public health problem. Major public health problem are heart disease and cancer. We have a strategy for dealing with that. But also on the list, we do have drug overdoses, not far underneath that, and homicides. So I'm going to talk about a strategy for that. We have or should have a strategy for each of these major causes of death. So here's the trend in these in the last 10 years or so. Drug overdose deaths and homicides have always been fairly common, but we saw a surge in overdose deaths starting around 2010 or so, peaking in 2017 at over 1,200 deaths. That, by the way, is more than 30% higher than the number of deaths we had at the worst year of the AIDS epidemic from AIDS back in 1994. So major public health crisis, and about 3 times the deaths from homicides. Homicides, by contrast, have gone up and down a little bit, but have been within a narrower range than these overdose deaths. So just focusing on overdose deaths specifically, the problem's kind of unfolded in a series of waves. This is the drugs that were been found at autopsy of people who died of overdoses. And you see the first increase occurred between 2003 and about 2010, and that was from pharmaceutical opioids, people who were getting prescriptions of these drugs. Then you saw an increase in overdose deaths involving heroin starting around 2011 or so, and then we see this huge increase of overdoses involving fentanyl, a synthetic opioid which is now marketed in the street and is very potent and very likely to cause an overdose. For any public health problem that causes deaths, the deaths I think of as the tip of an iceberg, but for our public health strategy we need to understand the entire iceberg. So this is my attempt to sort of describe the iceberg around the opioid crisis. So we have about 1,200 overdose deaths in a year, about 14,000 people in treatment for opioid dependence. We know that that's a fraction of the people who are addicted to opioids. Heroin use last year from surveys gave an estimate about 55,000. We did a survey in 2017, asked people, are you currently taking prescription painkillers? And out of that survey, we got these extraordinary estimates of about 168,000 people currently taking them. And as far as getting a prescription in the last 12 months, close to 500,000, or 1 in 3 adults in the city. So an enormous number of opioids out there, leading to a small fraction, but still a large number who die of overdose deaths. How do we get here? Well, prescribing of opioids surged in this country as a whole, as well as in Philadelphia. This is a graph that was put together on national data from the CDC showing the increase in sales of opioids in the green line there. And tracking that very closely was overdose deaths and requests for treatment for drug addiction. So it's clear that the more that we promoted and sold these pharmaceutical opioids like OxyContin and Percocet, the more people got addicted and more people died of an overdose. And we're still suffering the consequences of that today. So to reduce the number of overdose deaths, we're going to have to unravel that entire iceberg. And our basic strategy in the city has three parts to it. We want to reduce the overprescribing opioids. The health department, we're educating physicians with some very, very simple messages about what to prescribe and what not to prescribe around opioids. And then for those people who are already dependent on these drugs, we're trying to get more of them into the most effective form of treatment. That's medication-assisted treatment. I hope some of you have seen this media campaign that was out here just in Philadelphia last summer. And then for those people who are dependent on opioids and not in treatment, we want to at least keep them alive until they are ready to go into treatment. And so we're encouraging the use of naloxone. That's an antidote to opioids. Anybody can buy it, anybody can carry it, anybody can use it to save a life. We've got messages out there as well encouraging people to carry it and use it. So that's what's happening with our overdose deaths. Let me talk about gun violence. People often make the mistake of equating gun violence or gun homicides, or homicides with guns. And it's true that the vast majority of homicides are caused by guns, but the major way in which guns kill is not by homicide. The major way that guns kill in the country is suicide. Many more suicide deaths than homicide deaths in the nation as a whole. But for the purpose of tonight, I'm going to talk about firearm homicides, in particular firearm homicides. And this is our trend in Philadelphia. Not huge changes over the years, but we are seeing that it seemed to bottom out around 2013, 2014, and we've seen sort of a slow rise since then. I'm going to come back to that in a minute. And I wanted to sort of describe the epidemiology of homicide in Philadelphia here. First of all, we know that the homicide deaths occur very strongly in low-income neighborhoods. See on the left there, the gradient across neighborhoods, much, much higher rates in poor neighborhoods than wealthy neighborhoods. And this is the demographics of the victims. They're overwhelmingly men, African American, Hispanic, and young, between generally ages of 15 and 29. So this is it's a really very narrow population that's affected here. But on that population, the risk is fairly high. If that's the tip of the iceberg, what's the iceberg here? This was my attempt to try to describe the iceberg. So this is really a description of how many people we have who are disconnected between the ages of 16 and 24. By disconnected, I mean not in school, not employed, and I think throughout history we can say young men who don't have something to do get into trouble. And so this is the number of people who have a risk for that. This counts both males and females, but overall we got about 24,000 people in the city who are at risk for that purpose. A greater proportion that are African Americans, and they're the ones that are going to be more likely to suffer the consequences of that. What do we know about homicide itself? About half of these are involved an argument, as the police characterize that. And that means that these people know each other. And about a quarter of them are drug related. So these are not so much random shootings, I think we may worry about it for ourselves, but these are people who are maybe involved in the drug trade and there's an argument over that or something else. This is just showing a graph that our chief epidemiologist put together, pointing out that as the overdose deaths rose between, say, 2011 and 2016, so too did the percent of homicides which were drug related. So we think that increase that we're seeing in homicides in the last few years is related to violence around the drug trade. So if that's our understanding of the problem, one other thing I want to point out before I get to our solution. We have to think about the availability of guns as a contributing factor here. This is just data from a national study looking at the relationship between the percent of homes that own guns and the number of gun-related bad events, assaults, robberies, homicides, etc. You can see basically the more guns in circulation, the more likely these guns are to be used in a variety of different ways. Pennsylvania's around here. We are towards the high end of the lowest, I guess the second quintile here. So it says if we had more guns, we would have more violence in Pennsylvania. If we had fewer guns, we would have less violence. So what's our strategy for this? The mayor just unveiled a comprehensive strategy for gun violence reduction. I can't get into the details, but it has several elements to it. One of them is responsible guns. We want to keep guns away from the hands of those who could particularly likely to shoot each other. I can have a sense for who that population is. There is some law enforcement actions that are really valuable here. The vast majority of people who are perpetrators or victims have lots of contacts with the criminal justice system. There's an opportunity for law enforcement to I think, redirect them. There's also a role for behavioral health and trauma treatment around people. These are people who themselves have frequently had a history of psychological trauma. And then there's poverty reduction and revitalization, taking those folks who are disconnected and they're at risk because they're disconnected and trying to get them, channel them into education or employment so that they're less likely to be disconnected. That's a very quick strategy on both of those, and I'm happy to answer any questions.
Our second speaker is Dr. Allison Kenner. She's Associate Professor of Science, Technology, and Society at Drexel. Her first book, Breathtaking Asthma Care in a Time of Climate Change, investigated various strategies that are used to address the U.S. asthma epidemic, including public health projects here in Philadelphia. She teaches courses on environmental health, climate change, and ethnographic research, and she runs the Philadelphia Health and Environment Ethnography Lab. Dr. Kenner is going to address the question, how does climate change threaten Philadelphians, and how is the city of Philadelphia meeting this threat?
So thank you so much, Beth, Maureen, and Sarah. And also, it's such a pleasure to be up here tonight with the other panelists. It's a real honor. So I was asked to answer the question, how will Philadelphia be impacted by climate change? And what is the city doing about it? And that's a huge question, and there is a lot of material to answer that question, so I've also tried to narrow. And I have to say that as someone who studies urban responses to climate change in the U.S., I think we're very fortunate to live in a city where there is deep expertise on climate change and a lot of work happening on the ground through various networks, including the city government itself. And one of these Philadelphia networks is the Climate and Urban Systems Partnership, which was a 6-year-long project run by folks at the Franklin Institute. And they organized a network of more than 60 organizations to do climate education in our city. And the project is true boots on the ground community outreach and public education that I really think defines public health or some part of public health. And as a social scientist who studies urban responses to climate change, I have to say that I'm really not aware of any other project to, talk about the global or international connection here. I am not personally aware of any other project on climate change education that is as robust as what we have here in the city of Philadelphia. So my answer to these questions are rooted in what I've learned as a CUSP member, and much of what I'll go over tonight is taken from our Climate Health and Homes workshops, which I facilitate with 6 other people from organizations around the city, including staff from the Philadelphia Department of Public Health. So this slide is from the Centers for Disease Control, and it outlines the various public health impacts of climate change. I'm going to focus on heat waves, air pollution, asthma and allergies, and also extreme weather events tonight. And these are the impacts that we focus on in our Climate Health and Homes workshops, which our team has been facilitating here in Philadelphia since 2014. We've run 18 workshops that have been attended by more than 400 Philadelphians, mostly low-income residents living in neighborhoods that are most vulnerable to climate change impacts, flooding and heat waves especially. And in Philadelphia, Philadelphia's Climate Educator Network, we like to say that the city's climate change motto is warmer, wetter weather. So hotter than the 20th century and for longer periods of time, which means more heat waves, longer summers, warmer nights, and later frosts. It also means heavier precipitation events, more intense downpours, and bigger snowstorms. So in our workshops, we talk about air pollution and heat waves and extreme weather events like hurricanes and blizzards. And we do this so that citizens understand how their environment impacts their health and what they can do to prepare and reduce risk for themselves and their families. We also talk about what the city is doing to mitigate and adapt to these impacts as well. So the first thing I'll highlight is the urban heat island effect, because Philadelphia is a city that suffers from the heat island effect, and this is very much a driving force of heat waves and air pollution events. So the urban heat island effect describes built-up areas, cities, that are hotter than nearby suburbs and rural areas. More pavement and cars, fewer trees and green spaces, and a greater density of buildings, which all use air conditioning, produce higher city temperatures and air pollution. And this actually creates a feedback loop so that air pollution is trapping heat, and heat is generating more air pollution, or the conditions of heat waves produce more air pollution. So for example, the annual mean air temperature of a city with 1 million people or more can be as much as 2 to 6 degrees Fahrenheit warmer than the surrounding suburbs and rural areas. And in the evening, the difference can be as high as 22 degrees Fahrenheit between the city and rural areas. So here's some data from Climate Central. This is a great resource for anyone who's teaching on climate change or doing public presentations. Many of my slides are from Climate Central. The data on rising heat since 1970, an average of 5 more days a year here in Philadelphia, 5 more days a year above 95 degrees Fahrenheit since 1970. Heat waves, or heat health emergencies as they're called here in the city of Philadelphia, have been and will continue to be a major issue. Between 1971 and 2000, Philadelphia had only 4 days on average with the heat index, which is temperature plus humidity combined, over 100 degrees. But in the coming decades, the city will experience an average of 29 days a year with a heat index over 100 degrees. That's between years 2036 and 2065. So heat islands can affect communities by increasing summertime peak energy demand, air conditioning costs, air pollution, greenhouse gas emissions, and also health impacts such as heat exhaustion and stroke, other heat-related illnesses, and mortality. And of course, this is going to impact people who live on the streets and people who work outside, sanitation and construction workers, more acutely than us who are not working outside, as well as the elderly. So a lot of our workshops are really directed towards elderly populations. And it's not just heat waves, although that is the most acute public health issue that we're dealing with right now. Our first frost is coming 17 days later each year, which means a longer mosquito season. So potential for vector-borne illness. So we have 141 days now on average per year since 2006. That's quite higher than it was decades ago. So the heat island effect does more than just increase temperatures and health risks in cities, it also increases air pollution. And we're already experiencing increasing levels of ground ozone and particulate matter, higher pollen loads and longer pollen seasons. Anyone in the room with allergies knows this very well. Some areas of the country are experiencing atmospheric events that could impact air quality here, such as wildfires down in the southeast. And certainly air inversions are an asthma trigger for some people. Philadelphia's asthma prevalence rate is twice the national average for adults and nearly 3 times that for children. And because asthma is an environmental disease, we need to think very carefully about how these climate change dynamics are impacting people with asthma and allergies. The asthma, allergies, air pollution link is something we focus on in our workshop because a lot of people will be impacted by this dynamic, either as someone who lives with asthma or allergies or as a caregiver. So in 2018 and 2019, on our workshop survey, 75% of attendees stated that they either have or live with someone who has a breathing disorder. So this is a huge issue in the city, and especially the communities that we work with. So we instruct people to pay attention to the weather, pollen counts, EPA's air quality index, which projects daily air quality and also provides recommendations for different population groups depending on air pollution levels. And these recommendations on this slide here are some of the things that we talk about in our workshop. So reducing the amount of activity outside when air pollution levels are high, exercising away from roadways, keeping your windows closed, reducing exertion outside during heat waves and air pollution events, for example. Extreme weather events are another climate change impact that we need to prepare for. One thing that PDPH and other organizations are trying to do is get families to create emergency preparedness plans. So in our climate health and homes workshops, less than 15% of participants reported having an emergency preparedness plan for their household. And fewer than that felt that they knew how to keep their families safe during a weather-related event, such as flood, hurricane, or blizzard. And we've also found through oral history interviews, we're doing an oral history project alongside our community workshops. We've done interviews with 49 people so far. What we're finding from these interviews is that people who do say they have an emergency plan are actually mean they have an exit strategy if they have a fire in their house. That's what they're thinking of when they think of emergency preparedness plans. So we're really trying to get people to shift their thinking to something much, much broader. So in our workshops, we talk about the urban heat island and heat waves. We talk about air pollution and asthma, and we do emergency preparedness planning in the event of extreme weather. We also highlight the Office of Emergency Management's many resources, and there are many, like cooling centers and Ready Philadelphia, all of which are designed to respond to acute climate change impacts here in the city. And as I mentioned, we also talk about the City of Philadelphia's adaptation measures, which address these climate change impacts. And there's a lot of really great work happening through the Philadelphia Water Department, Parks and Rec, and other organizations to reduce factors that are contributing to the urban heat island effect, and by extension, heat waves and hazardous air pollution events. This includes increasing green spaces by planting trees and vegetation, and converting asphalt and concrete areas into rain gardens. This is a rain garden in West Philadelphia. And installing cool roofs, which the Energy Coordinating Agency has really led the way on here in the city of Philadelphia for the last few decades. And of course, with climate change, we also need to change our city's infrastructure, the built environment. And as we do this, there will be a slew of public health benefits that not only reduce the risks of climate change, but also help tackle some long-standing public health issues like the asthma epidemic, like community violence and mental health, and other quality of life issues. Thank you.
Our third speaker is Dr. Robert Hicks, who is director of the Mutra Museum and also director of the Historical Medical Library at the Mutra. He was trained as an anthropologist and spent some time at the University of Arizona, where he earned money as a police officer. Do I have that right?
Yes.
Okay. And he also was with the Virginia Department of Criminal Justice with a strong interest in crimes involving historical resources, so he fits right in with Historical Society of Pennsylvania. Dr. Hicks will address the question, how did the influenza epidemic of 1918-1919 affect Philadelphians and the city itself? Dr. Hicks.
Thank you, everyone. I can answer Sarah's question without going through the 10 minutes. It was bad. It was extremely bad. Downstairs, we have some handouts on the table. There's a reading list, if you're interested, of more flu stuff if you don't get your stomach full tonight. Also, a brochure with upcoming events, including the grand opening of this exhibition next week. It'll be up for years, so if you can't get there in the next few weeks, don't worry about it. It's going to be there for a long time. We figured during the 5-year plus lifetime of the exhibit, people walking through will have in their heads something in the news about a pandemic or an epidemic or a disease breaking out somewhere. To talk about the flu, we talk about the last months, the late summer and fall of 1918. This is World War I. The United States is in World War I, and we have about 1.5 million troops in France at this time. A lot of them are getting sick with the flu, as it happens. And these are some images of destruction to put you in the frame of mind. In Philadelphia, this is us. 1.7 million. We've had a surge of wartime industry workers, a lot of them immigrants, living in the poorer neighborhoods, mostly in Southside Philadelphia. We have the largest shipyard in the world, it says here, so we're a real powerhouse of wartime industry. But it's worth remembering that with the war going on, a huge segment of available physicians and nurses are not here. They are in France. Not a good time for a pandemic to strike. But it begins to show up. Signs like this go up. The city of Exeter was a British merchant ship that arrived with about 6 or 7 passengers who had flu. Authorities recognized what it was. There had been news reports already about this thing called the Spanish flu, which is no different from the flu that hits Philadelphia. It just starts to show up and get publicized in Spain, so it had that tagline, nothing Spanish about it. There were quarantine measures put in place for those sick people. They were spirited off to a quarantine section of a hospital. Some recovered, a few didn't. But the word is out. The flu has come to Philadelphia. It's hitting throughout the country. It's hitting throughout the world. And it's in the news. So the fear is there. Many of you have heard this ditty that's been repeated a lot in the 100th anniversary year of the outbreak of the flu, which was last year. And this is a rhyme that did not originate in 1918. It actually originated in an earlier flu outbreak. You can imagine a little girl skipping rope to, I had a little bird and her name was Enza. I opened up the window and in flew Enza. So Boston's getting big cases, and of course Boston is right on the water, and it's also a location of troop transport. Soldiers mustered in other camps and trained, brought through major port cities. Some of them are arriving for transport to France already down with the flu. By the time those cases arrive in France, it's pure misery for the generals. The public health director at the time in Philadelphia is this man, Dr. Cruzen. Pleasant man, no experience in public health. This is a reminder that machine politics, Tammany Hall politics govern Philadelphia. In many of our South Side immigrant neighborhoods where the flu is going to take a terrible toll, there are no schools, there are no medical facilities. People are pretty much left to themselves. Money goes to whoever greases the skids with the political appointees. And Cruzen's a political appointee. He is slow to react to these reports. He does not undertake any planning, doesn't arrange any supplies, take any measures in anticipation of an outbreak. In fact, he publicly denies it's happening. The Navy is pushing him to do something. And at one point, when it looks like something bad is about to happen, he even wants to shift his entire responsibility to the Navy and say, well, you're experienced with this sort of thing, why don't you take it over? The Navy said no. The idea of a reportable disease is interesting because at first, the flu is not a reportable disease, meaning doctors who see cases have to report it. So there's a common reporting mechanism. But by reporting it, you're also obligating yourself to treat it and to maybe think further about how you should contain this problem. So without any uniform policy in the medical world of Philadelphia, diminished as it was, things are happening sporadically and not evenly. And there's a parade coming up. Now, the newspapers is up here with a question mark because I've got a few images throughout this presentation of patriotic imagery. There's a fund drive about to happen, the 4th National Liberty Loan Fund Drive. This is asking citizens to open their pockets and donate money to the war effort. This is happening as the flu is happening. Also, when you have bad things happen and you don't have an identifiable source, always blame an immigrant. And the immigrants of choice now are Germans. German music is not performed, people are killing dachshunds. There are lynchings of suspected German sympathizers. This happens in Philadelphia as well. Newspapers don't carry a lot of this because these posters, some of which you'll see, are supercharged with patriotism. Freedom of speech in the United States was probably never as restricted before or since than World War I. So to go out in public and criticize the government for maybe not doing enough for the flu, or even to talk about the flu as a thing that could be a destructive thing, could be viewed as anti-patriotic, and you could even get arrested. And yet, on September 28th, the largest parade takes place in Philadelphia history. It's a milestone. Here you see an image of it. The military is out in full splendor. This newspaper, the Philadelphia Inquirer reports on it, but the newspaper below, there's an arrow pointing to a man, happens to be President Wilson, who participates in the Liberty Loan Parade the day before in Chicago. Now, this isn't, as we say today, the vector for the disease outbreak, but there are a lot of people in that parade on the sidelines who have the flu and don't know it. And they're going to know it very, very soon. You see that little volunteer button. If you bought Liberty bonds, you earned one of these honor buttons. And if you went in public without an honor button, people would publicly accost you and accuse you of being a slacker. And I am wearing a 1918 button, so there's at least one non-slacker in this room right now. As you see from this ad here, you can shame your fellow citizens who do not have the button. But Cruzen, even up to this point, is reluctant to admit there's a problem, but he is saying avoid crowds. He's starting to convey some advice to the Philadelphia public that's been conveyed from the Surgeon General of the United States. 2 days after the parade, he says we have an epidemic. 1 day later, 72 hours after the parade, every hospital bed in the city is filled. Then we are into the first week in October. Look at the mortality statistics. 700 1 week, 2,600, 4,500. The highest mortality day was October 12th. So this is happening very, very fast. Now, immigrants, I've mentioned arrives. These are posters that have been all over the place. Beware the Hun. They always have bloody knives or bayonets, bloody boots, stoop-shouldered, ogreish, and they're always after our women. Now, you see here a lamppost with a Spit Spreads Death poster. It is covering up an earlier poster from the Liberty Loan Parade. So things are happening so fast that the patriotic banners are still up in the city when public health officials come through and start slapping Spit Spreads Death signs. Other cities are mandating the wearing of gauze masks. Philadelphia did not do that, but this is part of the campaign. Remember, there is no flu shot at this time, and the virus has not yet been identified. Bribes. Physicians and nurses are in such short supply, and people are so fearful that they are going to neighborhoods, they're going to individual houses, and people are willing to offer up to $100 in 1918 money to get that doctor that's across the street to come to your house next, or first, or that nurse that's making a house call. Such are the times. Flu is just not a bad cold. Flu is a very bad thing. And some of the soldiers, 1918, who were getting it said, it was like being beaten up with a club. So it has an incubation period, a recovery period, if you recover. About a quarter of all Philadelphians came down with the flu during this period, end of September through end of October, early November. Aches and pains, you get inflamed membranes, but in the extreme cases, you could become very disoriented. Pressure on the optic nerve, your color perception begins to change. It can affect your other senses, your hearing. You may be disoriented. In the extreme cases, you start bleeding out various orifices that you're not supposed to do that. Your teeth may come out, your hair may come out. You see an image of a man here in cyanosis, and if you've got him with his blue face, he's probably mortal. People described flu victims as having a distinct odor, hence the musky straw that I've got up here on the slide. And the reason for the cyanosis, and this is not pretty, is that effectively what the virus is doing is tearing open the alveoli in your lungs, those cells that get the oxygen into the blood. So you're suffocating. You can't get that done anymore. And your lungs pretty much dissolve into a frothy, bloody mix. And you die. So this is what's happening. Public places are being closed, schools, theaters. You are encouraged not to go out in public, which is good advice. Stay home if you can, have access to a food supply, get a lot of rest. If this should happen today, or the flu pandemic of some unknown strain of flu, it's probably still the same good advice. Here you see a makeshift hospital set up, and the newspapers are starting to cover the losses. And the losses are all across the spectrum of humanity, from high to low. In fact, just as in the 1793 yellow fever epidemic, where the city becomes disabled, infrastructure comes to a standstill, 1793, the mayor used to put an ad in the paper saying, anybody that would help run city government, just show up tomorrow. And people would do that. Same thing happened in Philadelphia in 1918. Here you see Spitz-Red's death on a trolley car. So everything's breaking down. There is a genuine blue flu here. Police are just not in evidence. All the services are down. Remember, telephones go through switchboards. Switchboard operators are now sick. They cannot attend. There are not enough coffins. There are not enough ways to bury people. We have scenes out of medieval Europe here. Seminary students from St. Joe's were paired up, given a cart and a horse, and told to go up and down the neighborhoods collecting bodies. People would bring the dead out and put them out on the street. Sometimes you'd have to go in and retrieve the dead and come out and get it. There were no places to take the bodies. People would take them to cemeteries and just leave them there. City morgue only had a capacity for 36 bodies. Well, that didn't last long. People would just stack them up. And of course, there's the end of summer heat. So you know what that's doing to the bodies. The real heroes here in the medical profession are the nurses. But with these posters reminding you about patriotism, look at the one behind the nurses. If I fail, he dies. And it shows an image of a soldier. So these are the stakes at work here. The Red Cross would come out with little aphorisms and mnemonics to help remember what to do to stay healthy. I think one of my favorite is to get you to wear gauze masks. Obey the laws, wear the gauze, protect your jaws from suffering laws. The fund drive ends. Forgot about the fund drive? With everybody getting sick and everything disabled, Philadelphia not only met, but exceeded its fundraising goal. But this is where the other dimension of heroism really kicks in. And I have to give some credit to Cruzen here because he waits until this gets pretty bad before he starts to act in significant ways. You see this ad here, Influenza Sufferers Information Service. There was a council, the Council of National Defense, mostly citizen-run, set up as the war effort began because with all the influx of city workers, industrial workers, and all these industries, we wanted to have fair working standards and fair labor practices overall, fair wages. So it was a citizens' council to oversee that. They shifted their attention from that to getting self-organized as a city to deal with this problem. Selfridges department store became Flu Central. Phone number here, you call, you get somebody on the other end who would coordinate services to whatever the need was. City divided into districts, available medical personnel assigned to those districts, and run out of a volunteer headquarters. Dr. Cruzen, wisely, decided to devote city funds he was now beginning to grab a hold of and hand it to the citizens group and say, you're running a good show here, keep doing it. So by November, this is what we were left with. The armistice happens. We've got no memorial anywhere in Philadelphia to what had just happened. Everyone wants to get on with finishing the war. The war is the dominant banner. And you're going to see graves of soldiers. And it's worth remembering that most of our World War I deaths of soldiers were flu, not combat. So these are the statistics summing up what happened. For a 6-week period, one Philadelphian is dying every 5 minutes. It's between 17 and 20,000 over the course of about 6 months. And the country starts to move on. I mentioned the censorship. There are no federal assets that have been brought to bear to this problem because everything is aligned to the war effort. But what does it do to the infrastructure overall? Hospitals pick up and operate as before. There's no big, no distinctive, no major change in infrastructure and how we do things. But behind the scenes, those scientists that got to work to try to find a flu vaccine during 1918 continue to do that work. And by the 1930s, they finally identify the virus. By the end of World War II, we get a good vaccine. You still have big social problems. I mentioned here orphans. There were houses where the parents were sick and died. Kids went wandering the streets. And for a time, the advice was, you see a loose kid wandering around, just take him in. That's it. So we don't have that large picture emerging. There was no summary moment. There was no huge national commemoration of any of this. It was just the war. That's part of the reason we're doing our own exhibit. From 1918. Thank you.
Our last speaker is Dr. James Higgins, who's a lecturer at Rider University in the Department of History and Philosophy. He's done quite a bit of research in influenza in American as well as European cities, and he has his bachelor's from St. Vincent College, master's from Duquesne University, and his PhD from Lehigh University in history. He's written extensively for Philadelphia Encyclopedia and other publications. Dr. Higgins will be addressing this question. How and why did the city of Philadelphia establish a Board of Health, and what was the impact of its creation? Dr. Higgins?
Good evening. Thank you very much. How are you? I'm going to try tonight to answer two problems in 10 minutes. I'm going to try to go through 300 years of history in about 10 minutes. So, when we say, well, when was the Board of Health established? Why was it established? We've got to flip that question around and I think try to establish that there are a number of iterations of the Board of Health, the Bureau of Health, the Department of Health that are established over a period of time. So, I think we have to remember that well into the 20th century, most public health appears to be reactionary. You have to react to problems. Okay, and we'll get to that a little bit later. Why that occurs. We are constituting ad hoc boards of health for a few weeks or a month or two when an epidemic breaks out in the 1700s. You burn smudge pots, you burn the belongings of people who might have been infected or died, and then you watch your ad hoc Board of Health just disappear until the next smallpox outbreak or diphtheria outbreak occurs, and you get some leading citizens together. Although by 1700, we do have an on-again and off-again quarantine and inspection of ships. And that gives us a bit of an international component there. Throughout the 18th century, we'll see those ships increasingly quarantined and inspected, of course, for yellow fever. We can trace the history of the Caribbean through the yellow fever ships coming in through Philadelphia throughout the 18th century. And in fact, it's the 1793 yellow fever catastrophe, one of the two great catastrophes in Philadelphia that are widely studied around the world. My colleagues in Europe and South Africa also look at the yellow fever epidemic in 1793 as they do the influenza pandemic and its iteration in Philadelphia in 1918-1919. In 1794, as a result, we'll set up a Board of Health. And that Board of Health will be strengthened in the first decade of the 19th century, okay? But it is still run by people who are dealing with infectious disease as a result of miasma, bad smells, and electrical interference from the atmosphere. Without understanding the causes of infectious disease, it is very difficult to have an effective public health body. An illustration of yellow fever turn of the 19th century, and progressing from health to prostration and then near death. The 19th century is a dynamic period for medicine. It's a dynamic period for the Board of Health in Philadelphia. We developed the largest single public health hospital, charity hospital in North America, and that's Blockley Hospital, for those of you who are familiar with it. You have wall remains at the University of Penn campus near the nursing school. It has both psychiatric and medical components to it. At times it is bedlam in this hospital. but it is a concerted, formal, institutionalized effort to extend care, especially to the very poor in Philadelphia, through public auspices. Middle of the 19th century, the Board of Health will get involved in problems that we tend in the 21st century not to think of as public health problems. Whether or not we're going to pave streets, right? We have muddy streets, we have cobblestone streets, so the Public Health Board is going to help to decide which of those streets we're going to pave, which of those streets eventually by the turn of the 20th century we're going to lay macadam down on. And of course that cleans up a lot of the dirt that people are complaining about in sections of the city. Night soil, cleaning out those cesspools. Philadelphia has tens and tens of thousands of them behind almost every building and every house in the city. And the Board of Health is instrumental in A, moving actual soil removal, filth from the cesspools, to nocturnal removal of filth, and setting out the parameters for the sorts of boxes and vaults that you should be sticking it in. So that what you don't have is the poor guy who's pulling it out of the ground whenever he wants, then trailing this up the street in front of your home or in front of your business, and then finally dumping it somewhere. Board of Health is also instrumental in helping to lay out plans for underground sewage throughout the city. And then of course housing. Philadelphia and the Board of Health, and Philadelphia's health generally, often in historical circles gets a bad name in part because we're 100 miles from New York City. And New York City's Board of Health is a path-breaking Board of Health going deeply back into the 19th century. But as you mentioned in your talk with respect to federal government help, the feds are not really in healthcare, and they're not really in public health until well into the 20th century. And so you have to look at it at the state level. What are Pennsylvania's laws concerning health in cities of the first and second class, right? So you look at Pittsburgh. Pittsburgh is the worst city in America in which to have a child or to live as an adult, with higher mortality rates in every category of disease, and that includes Chicago, which has a very bad reputation for health. And so when you compare Philadelphia to Pittsburgh, there's actually no real comparison that you can make. Right? At the same time that Philadelphia has 20.4 deaths per 100,000 from typhoid, Pittsburgh has 144. Okay? So these are the kinds of comparisons we have to make. All right, so don't get bogged down, especially for those of you who are historians, when we have a kind of an overly gloomy look at Philadelphia's Board of Health and at its overall morbidity and mortality rates. Because usually those comparisons are with New York City. And you're dealing with really two different animals here. Municipal Hospital for Contagious Disease, 1866. So we know 1882, Robert Koch links finally a single bacterium, Mycobacterium tuberculosis, with a disease, tuberculosis in human beings. 15 years before that, we set up a municipal hospital for contagious disease on Lehigh Street. It is, to be fair, mostly a place where poor people with serious infectious disease are taken to either recover and be released into the community or to die. But we do then have at least a semblance of a move to move the poorest and the sickest from Blockley Hospital into a place with dedicated physicians who are looking at infectious disease and trying to solve it. But we'll see the next iteration of this hospital do actually much better work. One of the more famous photographs of Blockley Hospital, Philadelphia General. So you may be more familiar with it under that name. 1903, the state legislature decides that they're going to revamp the Philadelphia Board of Health and rename it the Bureau of Health and Charities, boost it up to the Bureau status. That last word, charities, serves as an indication that they're still going to shackle this new iteration of the city Department of Health with taking care of charity cases. And not just in terms of medicine, but in terms of trying to provide some housing, some food for the very poor in Philadelphia, which we're starting to move away from in other cities in terms of defining that as a job for the Board of Health. It sounds good, but you're giving the Board of Health a job that they're not really suited for and they're not really interested in doing. The Contagious Disease Hospital is rebuilt up on 2nd, 3rd, and Luzerne Street, where Thomas Alva Edison High School is now. For some of you who researched the flu, we have mass burials there because New Cathedral Cemetery has always provided a potter's field for the newest iteration of the Contagious Disease Hospital. But within that hospital, I use that popular term hot zone because individual doctors, especially Benjamin Franklin Royer, who goes on to lead Pennsylvania's fight against the flu in 1918, 1919, is doing original research there. He's doing research in an atmosphere where he's dealing, and his nurses and fellow doctors are dealing with the most infectious and deadliest diseases on earth at the time. Smallpox, diphtheria, though we have antitoxin, measles, mumps. He has cases of anthrax. He has cases of what they thought was plague at the time going through. Right? So they're dealing, and we have nurses who are dying there. They're in the direct employ of the Board of Public Health in Philadelphia. It's during this period and under him that we have the first laboratory established outside of City Hall. And so you get a sputum sample, you have to run it down to City Hall, where you take it down to a basement lab. Somebody would review it, and they get back to you and say, okay, well, this is what your patient has. So, well, this is nonsense, and he puts it on site. He claims, at least in his records and in his publications, to be the first one to administer a new antitoxin for anthrax in North America, and he helps to revamp guidelines for antitoxin use for diphtheria. And his argument is, look, even if you have a suspected case of diphtheria, right, giving someone a high dose of antitoxin isn't going to hurt them. You may very well prevent symptoms. Don't wait until the symptoms occur. And this is picked up around the country, especially by urban boards of health, and decide, okay, we're going to follow this kind of advice. 1918, 1919, that second great epidemic that the Board of Health, the Department of Health, is going to deal with. So, no matter where I go to lecture in any country, anyone who studies influenza has to study Philadelphia. Right? It's a great unraveling of a city. Low side 13,000, high side 19,000 deaths. Wilmer Cruson had a hatchet job done on him by a popular historian named John Barry. And his reputation, which I'm trying to help recover, it really does him a great harm. But this is an epidemic that crashes on the city, and the Board of Health attempts to ameliorate it by working with, as you said, the Archdiocese of Philadelphia. We also do a pneumonia commission study with a private-public partnership, where the city of Philadelphia takes all the sputum samples, tens of thousands of them, and makes essentially the same sort of a connection between rural African Americans who are moving up into an urban area. They have desperately poor housing. And they're not as used to the sorts of bacteria and viruses that are floating around in a large urban area. And this is the first time that I found in a record that an urban public health department makes that connection. The Army's done it because they're dealing with a smaller population. They can really watch groups of rural African Americans, rural Southern whites being injected into camps that have a high population of urban people. And the epidemic of pneumonia and measles follows. We see very high death rates with influenza 1918, 1919 in these camps. This is the last major outbreak until you get to 1976, Legionnaire's disease, where Philadelphia is kind of put on the infectious, contagious disease map. And so Philadelphia's iterations follow reaction to disease, and then finally in the early 20th century we get a couple of pioneers in there, and they begin to actually chart their own course against infectious disease. Thank you.
All right, we're going to move the action to the table. I'll ask all the panelists to come up, have a seat, and sit in any order you wish. And I know I have scribbled down a couple of questions, but I bet our audience has some really excellent questions too. questions? Please.
We don't have the Philadelphia general hospital anymore, so I guess this is addressed to Dr. Farley, which is, we don't have the big public charity hospital. If we were to have another epidemic, what are the plans? Are we going to marshal our hospitals to deal with this, or maybe let us know what's the modern status now?
Yeah, each hospital has an emergency plan, and we have an overall citywide pandemic plan. This tries to deal with the surge of patients. It's going to be not easy though, I have to admit, because if there were a tenfold increase in the number of patients, there's nothing the hospitals can do to handle all of those. So I don't know the details of the pandemic plan, but there's been a lot of thinking about how you handle that. We certainly want to deal with as much as we can outside of the hospital.
I mean, would we be taking over school gymnasiums like they were showing?
I don't think so. I don't think there's, it's in the best interest of necessarily putting all these people together. Part of the reason probably we had such a severe pandemic in 1918, 1919 was all those people were together at the parade. And so having people stay at home is probably the best general advice. I'm saying we do have vaccines against influenza these days, and we also have medications. So a lot of our planning is around getting any viral medications out as quickly as possible, and getting vaccines out as quickly as possible. And we do think that we could attenuate any epidemic rate with those.
Go ahead, please.
So, as you had just mentioned, the main advice piece for if an epidemic does hit Philadelphia is to basically stay at home. What is the advice for homeless population?
I don't have the specifics on that. I would say that we're going to have a tendency, we're going to want to focus on again vaccinating as many people and giving antiviral medications to as many people as possible. And there is part of that plan is dealing with vulnerable populations. And so the homeless would be part of that. And that would be more the focus than where they go.
To the topic of gun violence, I know in the United States, the number of reasons that individuals own guns is for protection, self-protection, but it resulted in, I think it was like 0.6% of homicides was out of protection. That's why someone died was out of protection. Does Philadelphia, do we know the number of reasons why Philadelphia citizens own guns, and is that kind of?
We don't have any local data on that, but I think that most people perceive that they're safer when they're owning a gun.
Sure.
And there are good studies to show that that's not true.
Right,
you carry a
yeah.
gun in your home, you increase your risk of suicide fairly substantially.
Yeah.
That's a greater risk, and you increase your risk of homicide as well, because a family member or a intruder could get that gun and shoot you. So that misperception is something that we haven't done enough education about the
Right.
increased risk of that.
Right, that's what I was curious.
Let me insert one of my own questions, and this would be really for anyone. Since we're focused on Philadelphia's global medical heritage, that topic gives us the chance as Philadelphians not only to look inward, as obviously these four presenters have done, but also to look outward into the world. And I'm wondering, for any of you to take this question, what's your perspective on how Philadelphia sort of stacks up, looking at any other international cities, if you've done a bit of research on those?
We're the best by far.
Absolutely. And if we acknowledge that that might be the case, are there second or third runners up?
I'm mainly going to speak from ignorance. I don't know much about what's happening in public health in cities around the world. I will say that public health exists as a field in the United States in general, much more so than it does in Europe.
Can you say more about that?
Yeah, public health in Europe is more a subset of medicine, and whereas in the United States it's a bit more a separate field. And there are disadvantages to that, but there are also advantages to that. And so, techniques honed by the Centers for Disease Control really are sought after in other developed countries where they really develop that expertise that other places have. And I just know that from my time working with the CDC and dealing with some experts in Europe, that they don't really have that expertise there. Now, their health statistics are better than the United States, but that has to do with more social issues. But I think if there were sort of a major public health crisis, that we're in a better position to develop a public health strategy in this country in general than European cities.
I said earlier that, I thought that Philadelphia was doing some of the best work that I'm familiar with, and I don't clearly know everything, and I don't, see everything, but I think that as far as climate change education goes, which education is a huge component of public health, that I don't know of anywhere else in the world that's doing community outreach in vulnerable neighborhoods, among vulnerable demographic groups, the way that we're doing it here. That doesn't mean that it doesn't exist. I can tell you also that when I am asked to review work, grant proposals and manuscripts for work happening on climate change, I'm always struck by the lack of emphasis on public health. I'm always struck by the lack of attention to health, and that might be because I'm operating in the social sciences rather than in the field of public health squarely, but yeah, I mean, it also too, it might, I sometimes wonder that I've been biased because I work in a city that has such a strong climate change network, and there's so many people who are constantly talking about climate change. I often get asked, well, do you ever have any climate deniers in your workshops or in the events that you attend? And I don't in Philadelphia. I've only once in my 6 years ever come across a climate denier in a public space, which I think speaks to the broader political atmosphere in Philadelphia surrounding climate change, which is wonderful. It could be me and where I am going, but yeah.
Go ahead.
Question for Allison Kenner, who is my colleague at Drexel. We don't know each other. I'm in the College of Medicine.
Okay.
And I'm curious about the intersection of multiple bad aspects of climate change. For example, the summers are getting hotter, and so that leads to desire for more air conditioning. And again, thinking about Center City particularly, and all the new high-rises, have there been, and not being a physicist, I imagine that if a machine makes it cooler inside, there's got to be hot air being pushed outside, adding to many the problem. So with all these new towers going up, which I think should reach an end at some point, but doesn't seem to be, are there improvements or awareness concerning at least air conditioning and what can be done to reduce that effect? And really, how much does that really contribute? Or maybe it's just trivial to the overall picture, I don't know.
Yeah, so there's three things that come to mind. The Office of Sustainability is actually tracking some of this through their building benchmark program, and they actually have an online dashboard, and you can go and see which buildings in the city are using how much energy and what kind of energy. So that's a really useful resource to kind of see where in the city are our large energy users, our heaviest energy use. Interestingly, what I think about, I actually know less about who is generating the most kind of energy during heat health emergencies, kicking out a lot of heat generating energy. I know less about that than I do heat vulnerability in the city. So actually the Philadelphia Department of Public Health has a great heat vulnerability index. It's an online tool, and they're using it to identify neighborhoods that have, where the communities are most vulnerable in heat health emergencies. So I actually know more about where in the city people are most at risk than I do which buildings are contributing the most to heat waves, actually, and the urban heat island effect. I do have a new project, though, that is looking at some of this, which I will be starting later this year, that looks at energy production and energy vulnerability here in Philadelphia. So if you come talk to me in here, maybe you'll know more. I'm sorry. But it's an excellent and important question, and I think the Office of Sustainability is thinking about that based on their work. They have also, last year ago now, August 2018, they produced a report, guidelines for the city energy use going forward, to reduce energy use.
In the back?
Yeah, there's a theme here. Whenever you have effective public-private planning, regulation, a safety net, and restrictions on capitalism, you actually have an effective way of combating problems that we have. Global warming, the opioid crisis, the 1918-1919 flu epidemic. And I guess what I'm seeing is that seems to be the message, that when anyone wants to do whatever they want to do, you get into a situation where the collective society suffers from it. Just wanted to see how you felt about that.
I would just say, I wouldn't phrase it the way you did, but I would say that public health requires a strong public sector. It's something that cannot be done by individuals or by private institutions. So you need to have a government that is, that's an organization that its only interest is the community at large, to make the tough decisions and in some cases enforce those tough decisions. Where we have strong public health activities, you can respond well to public health crises where weak and the public health crises continue.
I'll just add that, my students, this is something that comes up in my classes quite a bit, what to do about corporate interests, for example. And, we often discuss in my classes, we cannot get rid of corporations tomorrow. So how do we force the corporate sector and industry and start really pushing them to be better players in the field?
Yeah, structurally, you have in the United States, if we look at gun violence, we have that awful incident 25 years ago in Scotland in a kindergarten, and in a very short period of time, essentially guns are outlawed. Australia suffers the same thing. My students at Jefferson now are going over essentially readings and discussions in gun violence. I was appalled a couple of weeks ago when I asked my students how many of you had lockdown drills in high school, and every single one of my students raised their hands and said, yeah, we had a lockdown drill. And that's, I think, one of the problems. There's no magic wand in the U.S., right, or anywhere else, and we've had this continuous tug of war between the public interest and the private impulse. And we're not Scotland, we're not Australia. There's a Second Amendment, and it is very difficult to do anything with respect to gun violence when you've got that Second Amendment. It is very difficult when we're looking at something like climate change, looking at something like insect vector illness, that's probably going to grow with climate change. When, well over 100 years ago, we decided that we were going to create suburbs willy-nilly. These are not towns outside of major cities. These are cul-de-sacs outside of smaller towns that are outside of cities. And right down to the 1973 energy embargo, which we were much more vulnerable to than Europe, because we've ripped out our commercial suburban commuter transit system from outside of most of our cities, and you rely on the car. I live in Allentown, and there isn't a transit system I can take within 20 miles of my house to get down here. I circled the block with my wife, literally did a 4-block circuit that took almost 30 minutes tonight. And so these structural problems they're not going to go away. And there are vested private interests, meaning individual, familial interests, and there are writ large those corporate interests, and there's even writ larger than that, constitutional, both state and federal, that have to be dealt with. And it's much easier, I think, in other countries to deal with some of these issues because their federal oversight is much stronger than ours.
Looking at it historically, the worst health crisis in American history was the Civil War. And the intersection of corporate interests, government involvement, government power, and citizen responsibility really come to a tight, uncomfortable merge in the Civil War. You have the federal government forced to create a hospital system and a military medical system, which by 1865 is the most sophisticated in the world. 1861 was nothing. It had to do this in a very short period of time. And yet, there was a constant demand on the government, wait a minute, you're creating big hospitals. Philadelphia is the second biggest hospital city in the north. Why is the government all of a sudden now creating a healthcare system that might outlast the war? This was a serious worry, and as soon as the war ended, hospitals closed as quickly as they could because the government was absolutely petrified of bearing the cost of healthcare, something that they hadn't conceived of having responsibility in at all. So from the Civil War forward, that argument continues to percolate, and then of course we get into population growth and everything else. It happens with drugs. High demand for opioids of a certain variety during the Civil War, but not enough manufacturing facilities. Philadelphia becomes a big manufacturing facility, and the government is forced to create government labs to not only produce enough quinine, for example, but also to certify that there's a purity here, there's a good standard. We need a reliable product. All those drug manufacturers out there said, oh, wait a minute, why is the government now into this business? They're competing with us. But the government was challenged as the war went on. What is the business of government in pharmaceutical production? And so this was highly contested in Congress, even as the war went on, but as a war necessity continued. War is over, people are still left with the big questions. So we have it in the same sense. These problems have a deep history, and it's very difficult.
Please.
I'll ask the Philadelphia Health Department. What is the regional activism within the tri-state Philadelphia region in terms of what the city is leading on?
Not sure I understand the question. What are we doing with other communities in the Philadelphia area on what? On opioids or on?
Well, in coordination to prevent pandemics, to integrate very excellent programs in the city that may be harder to do in the suburbs, and spreading information. Is there any mechanism for this, either within the RPC or outside of that? Excludes, of course, Newcastle County. So I'm asking what's happening in that respect.
So a couple things. You know, the boards of health and health departments really start in cities initially, but we now have state health departments. And so state health departments do have a function of addressing rural areas and places around cities. And so the state of Pennsylvania, for example, has a pandemic influenza plan, just as the city has a plan, and we're in communication with them about what those plans are. In addition to that, there are independent county health departments in some of the counties in Pennsylvania outside of Philadelphia. Montgomery, Bucks, I think, I lose track of which ones. We are in informal communication with them on a variety of issues. For example, our opioid treatment guidelines that we developed here and distributed to all physicians in the city. We decided, well, you know, a lot of physicians work in the city, live in the suburbs, and we have in many cases, their home address is not their work address. And so we work with the other county health departments, and do you mind if we just send these guidelines to every physician in the metropolitan area? And we did, and that worked out well. Probably there could be more coordination, but we definitely do that.
Thank you.
I wanted to ask you about Philadelphia seems to be on the leading edge when it comes to a safe injection site. I wanted to ask, is the Board of Health involved with that, or is it more of a political it's going on as far as trying to open it?
Yes, the Board of Health did hear that and did pass a resolution in support of the idea. It is not involved in the implementation of that.
But do they see it as a positive?
They do see it as a positive, yes, as a life-saving step.
I think we have time for maybe one more question.
I guess when Mr. Hicks and Mr. Higgins spoke about the flu epidemic in the early 20th century, it sounded to me as if there was a difference of opinion on Mr. Cruzen. So at the risk of starting a debate at this point with the last question, can you briefly explain, I guess, the more negative view and the what's behind that, and I guess the more positive view towards Cruzen? If you could just each briefly explain your perspective on him.
I'll go first because I want to defer to you because you're the public health board guy. I don't want to paint him exclusively negative. I mean, he did sort of ante up. My feeling is he did not pay sufficient attention to what was beginning to happen in other localities and maybe make some early decisions that might have made the infrastructure problem a little easier when the flu pandemic hit in a major way. I thought his attempt to sort of shift this over to Navy responsibility was maybe a bad move. I also thought that his reluctance to admit that he really had a problem until the problem was clearly on everybody's tables was not a good idea. But I'll turn it over. I know you're talking about, you mentioned rehabilitating him a little bit, and there's a larger involvement here with the Board of Health, which I didn't even talk about.
Yeah, so Cruzen, he has a long history, and he's looked at our first kind of scholarly examination of influenza by historians was Alfred Crosby's seminal work in 1976, and epidemic in case. And he gives a kind of a broad overview. He compares Philadelphia with San Francisco. Okay, says so San Francisco holds off the flu a little bit, probably because of their strong implementation of masks and quarantining, things of that nature. They're also on the West Coast, right? So this thing comes through Boston. It's the third major outbreak on the planet. The first one is in Freetown, Sierra Leone. The second is in Brest, France. And the third is in Boston. It's all within about 15 days of one another. Cruzen is one of the founders. He comes in at the Temple University School of Medicine, which was the only medical school in Philadelphia to accept African Americans, women, Jews, and actually offered 9 classes. And he actually has a public health care that dates back to the turn of the century. He works with poor people. He's a gynecologist by training. And so he runs obstetrician gynecology clinics, outpatient clinics for the poor, and then starts getting involved in Blockley Hospital towards the end of the first decade of the 20th century. A man named John Barry, who releases a book in 2003. He's trained as a sports writer, and he kind of switches over to history. He doesn't know that avian influenza H5N1 is going to reemerge in Hong Kong. So it emerged in 97 and reemerges 0405. When it does, John Barry's book then is picked up by George W. Bush, who declares the book a really great thing to read to understand what a coming pandemic would look like. And so John Barry, we credit him with actually slowing down the preparation for a national pandemic plan because of some of his own ideas of what should be in it. And so members of CDC, University of Pittsburgh, actually I've done a lot of work with University of Pittsburgh, and I think a dim view of him. And Cruzen makes for the perfect punching bag. Okay? So we're in East Coast City, right? We are 5 hours direct train in 1918 from Boston. But my examination of records already shows that we've already got people who are dying of flu at the Naval Yard on September 2nd or September 3rd. What I think we have to remember about this parade, right? Every community, even those of you from very small towns, if you look in your community newspapers, 20th of September 1918, I'm telling you, your town held a little parade. Okay, I'm telling you. Philadelphia's was the largest by far. It is the single greatest gathering in Philadelphia since the Exposition of 1876. Okay. We have tanks. We have a barrage of anti-aircraft guns that fire dummy fused rounds up in the air so that people can look up and see these aircraft that are produced on Long Island fly overhead, and you kind of have this spectacle of we're repelling an aircraft attack, right? So we have 30,000 plus people that march in this parade. Every square on Broad Street, from Diamond down to, I think it's Diamond to Mifflin, 36 blocks or 26 blocks, you have 2 and 3 minute men, and you have women who are wearing black come out and give impromptu talks about how their son died in France or how their husband died in France, right? The general view of Crucian is that he should have canceled the parade, which at first I agreed with when I was very young and I started looking at this, and I thought, oh my God, how can you have this when you already know that people are getting sick, right? But then you have to go back to the 1903 law that the state uses to revamp the Board of Health. And what that law says is, as long as council accepts the mayor's choice for public health director, right? The mayor at that point can remove that director. He can't appoint him willy-nilly, but he can remove him for any reason or no reason at all. We have both Pennsylvania senators, the governor, Charles Schwab, who is the principal director of Bethlehem Steel, which is the largest munitions producer anywhere on the planet. They're all coming to this parade. What I suggest to you is that we don't have any record that he tried to stop it, right? We do have him set up a 100-bed hospital in Holmesburg the day the parade kicks off. I think he knows what's going to happen. He tries to shut it down. He's removed immediately. There is no way he's shutting this parade down. There's no way he's shutting this parade down, right? What he can do is begin to address probably what he knows is going to happen. No one knows that 1918 is going to be this bad, right? No one understands that this virus is going to provoke such a response. And then after the fact, he sets up 10 emergency hospitals. He coordinates with the Archdiocese of Philadelphia to send the carts around. It's a disaster, any way you slice it or dice it. And I would suggest, and I do suggest in my own writing, that the vector is that parade, right? We have in Philadelphia the 3rd worst rate of dying of any of the major cities in the U.S. Pittsburgh has the worst, and that's almost certainly because of the deleterious conditions in that city, from the steel mills and the coke ovens, and we have an accountant who's in charge of the Board of Health, literally. And when he's asked 5 days after the state declares an all-points quarantine, well, is there an epidemic? His response is, well, an epidemic is a matter of opinion. Everybody has to make their own decision about whether there's an epidemic in Pittsburgh. Well, there's an epidemic everywhere. And then Scranton's number 2, and then we're number 3, right? And we're also the worst state to suffer in terms of death and death rate during that pandemic. So we have the 3 worst hit major cities, and we're the worst hit state. None of that is happenstance. You have an overarching series of conditions and factors that allow that kind of death rate to spiral out of control in 3 cities and in the state of Pennsylvania. And so, and Crucian goes on to become the head of Philadelphia University of Sciences. He gets the largest appropriation by dollar rate, so adjusted for inflation, in the history of the Philadelphia Department of Board of Health. In fact, the second mayor tells me to come on, and they revamped a block in the late 1920s. He's at points conservative, but the way I spin this around, there's an article I'm publishing, I think not this coming issue, but the issue next, the Pennsylvania Magazine History Biography, which HSB puts out. And I said, why don't you flip the script here for a second, okay? Take him out of the equation. Put a new director in a few days before that parade, before that epidemic starts. Now you're left with a decapitated Board of Health. A guy who is nowhere near, in terms of political connections, that he's going to have, right? What do you have then? And then I think, if you can imagine, I think you have an even worse disaster than you have on your hands already in October